Red light therapy is something that most people nowadays have heard of. We've been doing it for decades here at the Nerve Health Institute. And so we're going to have a podcast right now. We'll talk to you about one of our devices called a TheraLight 360. I think you're going to love it. Stay tuned.
Hello, everyone. I'm Cameron, and today I'm here with Dr. Chris Cormier. We're going to be talking about red light therapy and specifically a therapy that you have here, the TheraLight 360 bed. Good to see you, Dr. Cormier.
Likewise, Cameron.
A lot of people are talking about red light therapy nowadays. What exactly is happening to the body when red light therapy is used?
Yeah, so we have been in this photobiomodulation light therapy sector now for decades. And so many of the things I was talking about many years ago, people looked at me like I was crazy. And now those same people are saying, oh, yeah, you got red light therapy, right? Well, yeah, we've had it for many years. So light, our bodies need light. And people don't realize this, but we are basically your brain and spinal cord and all the major nerves that come off of it that power up all your cells. They're all needing light to be able to work. And it's like a light energy throughout our bodies. And unfortunately, people just don't get enough light energy. And the sun has, 50% of it is near infrared. We should be getting sunlight more than we're doing. Most people stay indoors. So basically, it's so important to have this type of therapy nowadays more than ever.
Yes. Is it true that red and infrared light can penetrate centimeters into the skin, getting into tendons and bones and even possibly the brain?
Yes, absolutely. Near infrared light definitely penetrates deeper.
Okay.
Infrared light as well. You want to think of infrared light. I always teach people this, but if we have a camera, a night vision camera, we can see infrared light. We can see you because we have a lot of infrared light inside of our bodies, and we just don't think of it that way. But that's how our bodies are made.
Research suggests that certain wavelengths can stimulate mitochondria and help cells produce more ATP, which is the body's energy currency. How significant is that for healing and recovery for patients?
Yeah, so basically when it comes to cells, you want to make sure that cells are getting adequate light energy on a daily basis. And I say that most people are deficient because we have trillions of cells. And so think about just there's a bunch of there's a whole spectrum of light, and some light we see that's called the visible spectrum of light, the colors like red, orange, yellow, blue, indigo, violet. Roy G. Biv is an old science thing sometimes people remember, but so that's just the visible spectrum, right? But then you also have infrared and you have x-rays and you have all these other types of light that we can't see. Some are not so good for you, like certain UV light can be not so good, but then we have infrared light in there and it's so good for our body. So the right frequencies, there's a lot of different frequencies you can use of infrared light or a range of frequencies as well as red light. All of those are very, very good for the human body.
Amazing. Let's go to more of your personal experience with red light therapy. When did you start using red light therapy in your practice?
Oh, goodness. I think around 2007 or 2008.
Wow.
And fast forward, we're almost 20 years of using that. So, but the way we're using light, remember, is a lot different than other people.
Yeah.
We started out, so I learned this technique really early using quantum physics, where we get into the brain. The brain has a spinal cord. It has all 88 major nerves coming off, and those 88 nerves connect to your trillions of cells. So there's like trillions of nerves. Each one of those nerves is fiber optic. They need light energy. And so we have a method where we can actually test the power in each one of those major nerves, figure out where the brain is disconnected, then put light energy back into it. So we have all kinds of light devices that do that. And our TheraLight 360 is what we're talking about today, but that's kind of I guess, icing on the cake. Yeah. When we figure all these things out with a patient, then we put the light energy back into them, then we go super saturate or saturate them even more by laying in a light bed.
Let's talk a little bit more about the TheraLight 360 bed. For somebody that hasn't heard of that before, could you explain what a TheraLight 360 bed is?
Yes, so there's different frequencies of infrared light that are inside of the TheraLight 360, and basically it's in a private room. When I got this device, it was number 12 in the world.
Wow.
And now they are everywhere, right? LSU has them. Texas Rangers has them for their athletes. I mean, they're all over, right? Because people know that they help with overall performance, and people feel better when you lay in this thing and you feel better. You go into a private room, you take your clothes off, and you lay in this bed. It looks like a tanning bed, but it's definitely not a tanning bed. It's infrared light that's coming out of this in different frequencies that coat every single cell in your entire body while you're in it.
That is amazing. Do you have any other red light therapies or infrared light therapies in your clinic?
Oh, goodness, yes. We have lasers, high-tech lasers. We have smaller lights that are LED lights that we have contour lights that wrap around you with pads with mirrored backing. Like we're pretty much a light center here.
Amazing.
Yes, that's part of what we have.
So some people, when they first hear about red light, I know I might be one of them, kind of go to Amazon, search up a little bit, try to find something. Would this be an option for patients to find a little cheap thing on Amazon that would work?
There's unfortunately, 20 years ago, there was nothing. You couldn't hardly find a light online. And now, nowadays the craze out there is people just going over these lights. And so, yes, you can buy really bad ones. You can buy really good ones. We have Nerve Health Institute, which is our clinic, but then I also built out an at-home educational platform. Everything we're doing in both facilities is centering on the body's ability to heal itself. Self-healing. Most people have not even heard what self-healing is, but it's your body's ability to heal itself. So everything we're doing is trying to get that self-healing to come back. And we use various things like oxygen, water, light, frequency. We use magnetism, nutrients, all these different things. And so when it comes to the best products that we recommend, like TheraLight, for instance, or all those other things we talked about, Body Chargers is a platform we created for home to help our patients at home. So we have everything in there that you could ever imagine, the products that we would recommend. So people can go there and take a look at that and just become a member, and then you get access, you get exclusive discounts, and you can get access to all of this plethora of knowledge we've been able to discover over the years.
With a professional system like the TheraLight 360 bed, how does these other red light therapies that people could possibly find, how does it compare to the TheraLight 360?
Yeah, you won't find anything that's stronger on the market.
Yeah.
I mean, it's literally, in my opinion, one of the strongest devices on the market to be able to get light energy into all your cells at one time, and do it in a healthy, safe way that just is extremely therapeutic.
Can red light therapy help with a lot of chronic inflammation or nervous system issues that people are having?
Yeah, remember we talk about the nervous system being fiber optic, and all the cells need light energy, and everybody's low in light energy. I mean, our clothing blocks light. So let's say you go out in the sun, well, you're not going to walk out there naked. Our ancestors did that for many years, but we just don't do that anymore. So we have our clothing blocks light. We stay indoors too much. We don't get enough light energy. So the reality is people need light energy. And so whether you just go out and get more sunlight, I tell people to do that. But certainly this is more of a saturation part in your body. We take it to a whole nother level where we test the nervous system, figure out where it's deficient, specifically get cell groups energized again, and then we super saturate back with that TheraLight 360.
At a cellular level, what happens when that light gets to penetrate that mitochondria?
Yeah, so basically cells love this light energy. That light energy goes in and it helps those mitochondria start to produce energy. Essentially, that's what it's doing. So these cells, because we're so low in light, a lot of times those mitochondria are not functioning properly. And I'll tell you something else. There's a whole nother side of this is blue light. We have more blue light in this world than ever. And there's all these theories out there where blue light is literally destroying mitochondrial health in people. So red light, infrared light's the reverse of that, where it's nurturing the cells, providing circulation. You want to think circulation coming back when that light gets to you, and it starts to get circulation coming back to wherever that light is. It also helps the nervous system better connect to those cells. So it's kind of a twofold thing. It's helping your heart stay connected to cells. It's helping your brain stay connected to the cells as well.
You kind of talked about this a little bit. What is the difference between just going sit out in the sunlight, gaining all the sun's rays, or using a red light therapy bed like TheraLight 360?
Yeah, so basically the sun has more than just near infrared light. 50% of it is near infrared light. But there's other light forms like all the different ultraviolet and everything that's coming out of the sun. So there's some really good things for the sun. But TheraLight's taking the good stuff out of the sun and putting it into a device to where you can get that specific, really, really good energizing therapy into your system from the sun.
People that have maybe not tried any red light therapies before might have some safety concerns or questions regarding it. Can using red light therapy too much cause issues like skin damage or skin cancer?
No, I've not seen any cases where you're going to cause problems. And again, when we're using things, you want to use it with moderation, right? Yeah. So it's not something you want to lay in a bed, 24/7 every single day. Just like you get sun poisoning if you're out in the sun for too long, you can get too much light. So what we want to do with our patients is just make sure that it's like each cell has like a fuel tank of light, and we want to just fill that fuel tank and try to keep it full in as many cells as possible.
Can red light be combined with other therapies that you have in your clinic, like EBU, hyperbarics, or the Bimini oxygen therapy?
We do it all the time. Yes, remember we all of our therapies in our office center on my OWL method: oxygen, water, light, top 3 ingredients in a human being, and then we also have frequency and also have grounding or magnetism, and then nutrients. So everything we're doing is always centering, and each person comes to us and gets a customized plan. So some people will get more in one direction and another direction, but we always get those basic ingredients back into our patient cells.
Amazing. Could therapies like TheraLight 360 and all the other therapies that were previously listed represent a future where people are less dependent on drugs and more dependent on going to these therapies?
The best patients we have will come to see us, and we go through like a corrective plan where we're going through using all our high-tech clinic devices, and then we're teaching them what to do at home with body chargers, with all the different methods. And they learn so much about being their own mechanic that they need us less.
Yes.
And they're able to take care of themselves. And we have lots of home devices that they can use to help keep these fuel tanks in place. And the TheraLight 360 is just a wonderful thing. I mean, literally, I do at least one session every week, at least.
Wow.
And my staff, everybody here does it. Our patients love it. It's one of those devices that pretty much we have a lot of favorites here, but I would say it's definitely one of our favorites.
Looking ahead 10 to 20 years from now, could light therapies become one of the most important tools of preventative health?
They should be.
Yeah.
They should be. They have been for 20 years in our practice.
Yeah.
So basically, everybody should know about physics in the human body and power supply between the brain and the cells. And that's what we're doing here at the Nerve Health Institute, is reestablishing and connecting the brain to the cells and enabling these cells to be better. So absolutely, light therapy should be a staple now and forever. It's based on our body's makeup and how it's made.
Amazing. Well, thank you very much, Dr. Cormier. That does conclude our talk today.
Thank you, Cameron.
If you can relate to what we talked about in this podcast, then subscribe to our channel and like this video, as it really helps the algorithm. Don't forget, if you want to help yourself with self-healing at home right now, then simply become a Body Chargers by Dr. Chris member. And remember, our clinic, the Nerve Health Institute, is open all year round for in-person visits. For more information, just click the link below.